Hello, hi, and good morning, everyone. Today we are going to see the topic COVID-19. As you all know, this is when we look around, it's COVID-19. So it's very important for us as nurses to get updated or to be up to date on our knowledge, and this will also help us in the competitive exams that we are going to appear. And this is the first tutorial that I'm making, so if you have any suggestions, like how I should improve, please feel free to write it on the comment section. And if there are any shortcomings from my side, please forgive me, so I can make sure that I'll improve myself in the videos that comes so far. So first, let's start with the history and origin of COVID virus. So, the coronavirus is also known as the novel coronavirus. So, it was first detected in a seafood market in Wuhan city of China. And from there, it began to spread to different parts of the world. So, by 11th March 2020, it was spread to almost all countries of the world that the WHO has to declare it as a global pandemic. So you have to remember the date. It was on 11th March 2020, the WHO declared COVID-19 as a pandemic, as a global pandemic. So this question can be asked in your competitive exams. So when did the coronavirus started? Actually, it started in mid-December of 2019. So then we'll see the epidemiology of COVID. So COVID has said that it is of zoonotic origin from bats, but it is just a theory because until today there is no any concrete evidence on if the bats were the organism that gave us a COVID virus. It just came as such from a seafood market. So just for the sake of theory or sake of like knowledge, they say it is related to bats and it's of zoonotic origin. But until now, the real cause of coronavirus or where it came from is still a mystery. So, and as we see the coronavirus, it is the structure of coronavirus is like enveloped RNA beta coronavirus. That is all you have to, remember as a nurse. There is an envelope, and inside that envelope, it is, that RNA of the virus is there, and the N proteins are there, and on the envelope they have spike glycoproteins. So, through which they get, attached to our body. So that is all you have to remember. It is an envelope RNA beta coronavirus. The source of infection is a person who was first infected by the novel coronavirus. So that is from where it began to spread. The source of infection is a person who is already infected with novel coronavirus. So we can never say the source of infection is like bats or from animals. It's a person who was really infected with the coronavirus. Now we will see the mode of transmission. Sorry. Let me see. Sorry. Okay. Sorry for the trouble. As I told, this is my first presentation online. So, I'll make this up. So next is the mode of transmission for coronavirus. The mode of transmission is first is a direct contact. When you are directly in contact with a person who is already positive, that is a first mode of transmission. The second part is the aerosol particles. That if a person who is having coronavirus sneezes, coughs, or breathes, some amount of sputum come out of his mouth and it is suspended in the air as aerosol particles. And these aerosol particles contain coronavirus. If we inhale that or it goes accidentally into our mouth, we can get infected. So that is the aerosol particles. Next is a patient body fluid. This kind of contact transmission happens mostly in healthcare workers who is in direct contact with the patients, like blood or a sputum and all those kind of things, and even feces. It can spread to a person's feces, that is a body fluid. Indirect contact with the surfaces and foamers, so that is the reason we have to sanitize our hands always, because it can stay on a surface like a doorknob or a hook or on a table for as long as 8 hours. So that is also one mode of transmission. So what is the incubation period? So once you get get the virus, you know the median incubation period is like the 5 days. Within 5 days you get the infection, or you have the signs and symptoms. That is a median day we say, but it can range anywhere from 2 to 14 days. So some people, the second as you got the virus and second day you see the signs and symptoms, and it can last up to like 14 days. Now let's see the pathophysiology. So this is a very important topic, the pathophysiology. Sorry again. Sorry. Okay. So next, let's see the pathophysiology of COVID-19. So what happens? First step, what happens? The binding of inhaled SARS-CoV-2 virus to the nasal epithelium via ACE2 receptors. So once we got the virus, we inhale the virus, and this virus get attached to your nasal epithelium. Attached to your nose via ACE2 receptors. So once it is attached in your nose, your body find out like some kind of viruses is there on your nose, and your body start with the immune response. So in the second step, what happens? The viral replication happens, and there is a limited immune response. So body is like it is just in your nose, so it's like local thing. So body doesn't have to work a lot, so the body will give a limited immune response. And the first two steps is what commonly happens in 80% of people. That is, in 80% of people, the first two step happens, and what happens? There is a clearance of infection, or the virus is out of the body with the first two steps. That is as easy as that. And that lasts up to 10 to 14 days. So that is the reason why we are quarantining a person for 10 to 14 days. The first two step happens, the body gives an immune response, and the virus is clear, and you are free from coronavirus. But the other 20%, then what happens, like if you're immunocompromised, or if you're in a high risk category, slowly the viruses move to your upper and lower respiratory tracts, and then into your pulmonary alveoli. So now you have a systemic response. It is not a local response. It is affecting your system. The viruses is got into a system. So what happens? The body will throw out a cytokine storm. That is in a very severe immune response your body will give against the virus. There is a rush of all kinds of cytokines, WBCs, leukocytes, neutrophils, and there is a war happening in your pulmonary alveoli. So as a result, fighting the infection, your pulmonary alveoli also get damaged, and that leads to ARDS, then septic shock, and then multi-system failure. Multi-system organ failure. So that happens, ultimately ends in your death. So this is a pathophysiology. If you want, you can take a screenshot of this and prepare a note. Every slide that I have presented, you can make notes out of that. You can expand your notes as well as shorten them according to the mark, or for the exam, like for a 5-mark question you don't have to write everything, and for a 20-mark question you can write everything, and you can explain the points which you feel that you should explain more. So next, see the clinical features. Clinical features, like we have common clinical features like fever, cough, sore throat, breathlessness, weaknesses, and running nose. These are the very common. And less common ones are the diarrhea, anosmia, and ageusia. Diarrhea, anosmia is a lack of smell, and ageusia is a lack of taste. And when you're studying or preparing, or try always to stick to the medical terms, so it will be easy. You get you can get accustomed to these kind of words, and it is easy for us to remember. and it's good when you use it, you're professional and you has to use a medical term. So anosmia and agousia, these are the clinical features. So next we will see what are the risk factors. Risk factors, age above 60, immunosuppression like as in AIDS or any, systemic inflammation. If you are diabetic, you are hypertensive, and you have any comorbidities like, heart or lung diseases, and, if you have cancer, if you are on a chemotherapy drug, if you are, taking any immunosuppressant, you underwent a liver or kidney transplant. So these are the risk factors. Then next we will see the laboratory diagnosis. So laboratory diagnosis, the first one is RT-PCR. RT-PCR is like the golden standard test for COVID-19. And in this test, we are directly checking for the virus, if your body has a virus or not. The second one is the antibody test. So antibody test is like the, that one looks like our pregnancy test. You just put the specimen and you get 2 lines and you are positive, and this test happens in like 30 or 20 minutes. But the drawback about this test is that it is an antibody test. So today you got the virus and you are checking for an antibody, it might come negative, but still you are positive, your body has the virus. Your antibodies may be produced within a 2 or 3 days. So this test is not that reliable. So RT-PCR test, we are checking for the virus. So even if today is you got the virus and we check and you will be positive, so that is a golden, it is a viral test and virus test and the antibody test. Okay, the next is what is a specimen. Specimen is normally the throat and nasal swabs in a viral transport media, VTM. So next, what is a management? So management, there is no definitive treatment available for COVID virus till now. So what we give is isolation or quarantining, then a symptomatic and supporting management according to the patient condition. Then we have to monitor for SpO2 and temperature. Then we have to give oxygen therapy in case necessary, and depending upon the severity, it can vary from a nasal bronch to a mechanical ventilation. Then we can give a prophylactic dose of low molecular weight heparin, because a major complication with coronavirus is that there is an increased chance of blood clotting. So it can give you a pulmonary embolism or a DVT. So we give a prophylactic dose of low molecular weight heparin, and if in case you have any comorbid conditions like any lung disease, kidney disease, treatment for that is also necessary. And also if the patient is getting into a septic shock, the management of septic shock is also necessary. So next is what are the preventive measures. Preventive measures everyone knows, sanitize your hands, wear a mask, and social distancing. So these are the preventive measures, and now the prevention has far extended into vaccination. So there are Covaxin, Covishield vaccine which are available. These vaccines are given 0.5 ml intramuscular, especially in your deltoid, and first dose after 24 or 28 days you have to take the second dose. So that is a vaccination. So thank you. This was all about COVID-19 or coronavirus. This was a small presentation. You can the slides that I have shown is actually the notes. You can the order wise you can write, and you can make a beautiful note of COVID-19, and you can use accordingly. If it's for more marks, you can add some more points, or if it is like 2 or 3 marks, it's just a management or just laboratory diagnosis, you can expand on each that particular point. I hope you all like the video. Please tell me the suggestions or what topic you want me to make notes and teach you in the comment section. Thank you all. Bye.